Hello, my name is Sharita Godwin, and I am a DNP candidate at South College. Today, I will be doing a presentation on Essential 5, which is healthcare policy for advocacy in healthcare. Now, this topic is of particular interest to me because I do hold a minor in public policy analysis from 2008 whenever I was in my undergraduate studies at UNC Chapel Hill. I feel that I will be able to use my backing in public policy analysis with my nursing degrees to be able to bring about change because I believe that it is through advocacy and policy that we bring forth change. The American Association of Colleges of Nursing has outlined the essentials of doctoral education for advanced nursing practice. There are a total of 8 of these, but for this presentation, we will focus on essential number 5, which is healthcare policy for advocacy in healthcare. We will also touch a little on essential 6, which is interprofessional collaboration for improving patient and population health outcomes. Now, these essentials are things that each DNP student should be able to exemplify at the end of their course. The DNP program prepares the graduate to critically analyze health policy proposals, health policies, and related issues from the perspective of consumers, nursing, other health professions, and other stakeholders in policy and public forums. They should also be able to demonstrate leadership in the development and implementation of institutional, local, state, federal, and/or international health policy. Also, they should be able to influence policymakers through active participation on committees, boards, or task force at the institutional, local, state, regional, national, and/or international levels to improve healthcare delivery and outcomes, educate others, including policymakers at all levels, regarding nursing, health policy, and patient care outcomes, advocate for the nursing profession within the policy and healthcare communities, develop, evaluate, and provide leadership for healthcare policy that shapes healthcare financing, regulation, and delivery, and finally advocate for social justice, equity, and ethical policies within all healthcare arenas. On the previous slide, we discussed some characteristics that each DNP graduate should have at the end of their program. These characteristics will enable them to go forth in healthcare policy to bring forth change, as they will be able to have the skill set necessary to help with the framework of healthcare financing, practice regulation, access, safety, quality, and efficacy. So we're going to look a little bit at this more in-depthly. Let's look at quality. That is the standard of something as measured against other things of a similar kind, the degree of excellence of something. So when we apply that to nursing, we would think of the DNP graduate as being the highest quality as they have reached their terminal degree. This would put them in a good position to influence legislation as they have extensive clinical background and they have a well-developed comprehension of the issues at hand. Also, to help regulate the quality and to ensure that each one has the proper qualifications, we know that a DNP graduate would have went to a school that has been certified or credentialed with one of the credentialing agencies, as well as have the board of nursing for whatever state that nurse is affiliated with that would regulate the body. Whenever we think of safety, we know that that goes hand in hand with healthcare policy and advocacy. We know we don't want, first do no harm. So that still plays into effect whenever we are advocating for our patients and for the healthcare as a whole. The DNP has the expertise that can be utilized during participation in root cause analysis using an investigative approach to determine causes of error, which can then be utilized to help effectively advocate for change. And we also must remember that it is not that we always seek to go to the top, straight to Capitol Hill, but we can also look at the local levels, more so in our institutions, where we're able to uh, advocate for policies to be implemented, whether it be to have safer patient ratios, nurse to patient ratios, or shorter wait times in emergency departments, things of that nature. So let's not also forget that whenever we think about safety and advocacy. Efficiency is also a big component of the healthcare policy and advocacy. When we think efficiency, we think of something running smoothly, there not being any breaks. So this is a very big component that DNP when we think about healthcare advocacy and policy, we also need to think cost. We want it to be cost effective. As we know, healthcare is one of the more lucrative businesses in the United States. It is not cheap whenever we discuss healthcare. So we want to be cost effective. And one way that we can help to show cost effectiveness is to be able to show how the nurse practitioner is able to bridge the gap as being a primary care provider, which would be at a lower expense of having a physician, whether that be a DO or an MD. Also, we must remember that quality care is better, more efficient, and less wasteful. Therefore, quality is going to be less expensive. So whenever we try to bring these changes, we need to think through everything and think all the way through. We shouldn't be hasteful whenever trying to bring about change. Everything doesn't have to happen overnight. We should be able to take our time to make sure that we are being very thoughtful in our manners and how we go about trying to implement policy. At this point in the presentation, we are going to discuss DNP Essential 6, which is interprofessional collaboration. This is not to be confused with interdisciplinary collaboration, as the terms are sometimes used interchangeably. Interprofessional collaboration occurs when two or more professions work together to achieve common goals, and is often used as a means for solving a variety of problems and complex issues. An example of this would be the Institute of Medicine and even a Joint Commission. So, interprofessional collaboration, again, is whenever we have different bodies coming together to bring about change. This could also be the nurse practitioners working with the physicians to be able to close the gap in patient care providers for rural areas. Interprofessional collaboration is defined as an ongoing partnership between professionals from different backgrounds, often doctors, nurses, dietitians, social workers, pharmacists, and possibly representing different organizations or work areas working together to provide services for the benefit of the consumers. Whenever we advocate, we need to remember again that we do not do this solely alone, that we need outside disciplines to be able to work with us so that we can provide better care for our patients. It is through that interprofessional collaboration that there's also less error whenever it comes to caring for patients, because we're able to work together, and we need to have these different disciplines working together to be able to formulate policy that's going to give us a complete overview of what it is that should be considered whenever trying to implement change. The impact of interprofessional collaboration can be positive when we're talking about healthcare policy and advocacy in healthcare. When we actively consult professionals, we are bridging professional gaps, which results in higher quality of care. Also, through co-location of providers working in teams. It's going to increase the collaboration. It's going to improve communication and also offer convenience for patients. Therefore, we are looking at safer healthcare, more efficient healthcare, and more cost effective healthcare whenever we are speaking about interprofessional collaborations. Due to the knowledge and skills, the DNP can play a vital role whenever it comes to this interprofessional collaborations, as they have the skill set and the knowledge that they are able to bring to the table to be able to converse with the dietitians, physicians assistants, occupational therapists, and physical therapists, and all the other ancillary departments that are vital to the healthcare system. So this brings us to the conclusion of this presentation, which was on DNP Essential 5, Healthcare Policy and Advocacy in Healthcare. From this, we can see that the DNP graduate is poised with the skills and knowledge that they need to be influential in effectively bringing about change in healthcare. They can do this by joining a local organization or professional organization such as the AANP, or they can be on Capitol Hill where they are a part of legislation there. However, we must remember that it is not the DNP graduate or the advanced practice nurse job to solely work along in trying to implement this change. That's where interprofessional collaboration comes in. As the DNP graduate is not an expert in legislation and politics, they are able to work together with those professionals to help to levy any type of ideas that they may have. Not only are they able to work with legislators and those in politics, but also just working with other disciplines to include physicians and physician's assistants, especially whenever we are trying to be able to work more cohesively together to be able to decrease those gaps in primary care providers, especially in the rural areas. So just thinking about that, we need to go forth as DNP graduates to see how we can effectively bring about change amongst our communities where we're at, and even more on a grand scheme as well. I would like to conclude this presentation with this quote: I am only one, but still I am one. I cannot do everything, but still I can do something. And because I cannot do everything, I will not refuse to do the something that I can do. I feel this is a very profound statement, especially whenever it applies to advocacy. We cannot do everything to make everything perfect in the world or in healthcare, but the one thing that we can do is what we need to do. At this point, I would like to leave the floor open. If there are any questions that you may have for me, you can either post them on the discussion board or send them to me in an email. Again, thank you so much for your participation in this presentation.